system disproportionately, how COVID has really exacerbated the financial, housing, and other challenges that many women contend with, the importance of birth workers like doulas and how they've made the birth process more empowering, and the need for more postpartum care for the mother and for patients and their families to engage with healthcare providers that reflect the communities that they serve. So a little bit about what we were planning to do tonight. I just want to get a chance to see how many people are now in the session. It looks like we have a bit more actually. So we were, as people were coming on, we were debating of whether or not we should still break out into groups or not, but it looks like there are enough people here, and it looks like Josh, you are on, and so we're going to ask you, we're going to break out into small groups. I think probably 2 small groups makes the most sense given the size that we have. We really want to hear your feedback on these issues. We look forward to hearing those, and so we're going to use the breakout feature in Zoom to get into sort of 2 small groups so we have a chance to talk. The idea is those groups are planning to last about 40 minutes. I don't know with the smaller size if we should cut that a little bit shorter, but we have a facilitator for each of those groups. And the idea is to spend about 10 minutes on some introductions. So this is also a networking opportunity and a time to get to know other people in the field and who care about these issues. So we want to make sure there is some time for people to talk to each other and get to know each other. And then we have 3 main discussion questions, and which are here. And so we'd like to ask to spend about 10 minutes on each of those discussion questions. And then we'll come back in a large group and sort of hear what people had to say. We have an interactive technology feature we'd like to use to sort of capture some of the major themes from your small groups. So I guess I just want to kind of take a pulse check and see, do we have the technology available? Josh, you're all
ready
set
to go.
Okay, so if you could put the folks into 2 different, we'll wait till all the folks come in. I see.
Yep, the rooms are closed.
Rooms are closed. Okay. Did we lose a lot of folks? Let's see. No, oh, I just didn't have my screen expanded. Folks are back. Okay, I apologize, my own Zoom issues. I can't wait to hear, Shaunesse and I can't wait to hear what was discussed in the groups. We hope you had a lively conversation. Before we dive into some bigger, large group conversations and kind of share back with each other, we just want to take a few minutes and give an opportunity. We know that some people really like large group and small group discussions and some don't as much. And so we wanted to give an opportunity for some reflection that can be anonymous as well on the 3 questions that were discussed. And so you see a link here, and I just put it in the chat. So it should be in the chat box there. I'm wondering if you might be able to take a moment or 2 to click on the link. It's with Padlet. And if you would not mind sharing under the 3 questions, either a major issue or theme that your group discussed, or something you particularly felt very strongly about that you want to mention from your own perspective. And so we'll just take a few minutes. You can just write under sort of the comments piece in the Padlet, and then we'll share it and then sort of discuss as a large group some of the big takeaways, issues, and perspectives from the conversations today. So let me know if anyone's having problems accessing the Padlet. And this can be individuals, not facilitators, although facilitators want to respond as well. This is for everyone, everyone in the group to sort of provide either sort of what you took away from your group discussion or any individual reflections. I can post this as well, put this up as people are responding. You can see how it is being populated. And if folks actually all have this up, I may stop sharing my screen so everyone can actually see each other. And maybe in another minute or two, Shaunesse, I'm going to pitch it over to you to start the.
Shaunesse, it sounds so peaceful.
That's because it's a turtle and a tank in my background. That's why. Yes.
I love the sound of water, so it's very peaceful.
Me too. If only I lived down here, it'd be even better. But I live upstairs where there are little dogs who make lots of noise. So I decided to come where it's far more serene. Yes. And on that note, so I'm looking at just checking a lot of the comments that have been shared so far. First off, for the group that I got to join for a few minutes, I really enjoyed hearing the snippets of conversation, especially the work that individuals are doing in terms of the research that's happening and how we're all learning about what is missing, whether it's in research, whether it's in paper development, or whether it's in lived experience. And I think that each of us being aware of these gaps helps us bring something from our own perspectives to the table to figure out how we can create better solutions, because clearly there are not enough out there. So looking at question number one, I'm also kind of like toggling back and forth between screens. So a number of the things that resonated, just the reality again that there's so much misinformation and that clinicians embody a certain arrogance and shouldn't be told what they should know or shouldn't know. And that there is a drive for things to be patient-centered, even if it's not necessarily the case right now, if some of us are feeling like we're just another check mark to get care done. Something else I'm seeing that's really important to have an advocate. Absolutely. I think that was something in going through the patient listening sessions that was most fascinating to me, the need for advocacy. And if you don't have that, how you can feel as though you're just being pushed through a machine and a process. And it's crucial to have additional clinicians, whether it's doulas or midwives, in your corner, because they do have a positive impact on maternal and child health outcomes, and that insurance companies and their involvement in patient care access are horrible. I actually, for 2 years, worked at a consulting firm where I had to figure out how to get claims paid correctly from insurance companies, and they do anything they can to deny claims, which is bogus, and we all know that. So based on some of the things that have been shared under question number one, specifically what resonates with you when you hear these themes, is there any
Has Shaunesse frozen for others?
Yeah.
All right. So as Shaunesse hopefully will be able to reconnect, I think the big question is, you know, anything you want to share from your group or specific reflections, or agree, sort of disagree with some of the items or issues that were raised here. Oh, there she is. She's back. But we'll open it up to the group to sort of expound upon anything that you've shared or want to react to.
Lisa, I'll share something from my group, which was wonderful and had a lot to share. One of the things that came out from a research perspective is that given how much in the spotlight these issues are, When is enough enough? We already know that doulas are helpful. Why are we not addressing this and going after this more aggressively? How do we increase accessibility? And the fact that COVID has put so much pressure on the fact that we know having an advocate by your side is essential, and you can't have that advocate there. So why are we not moving the agenda and creating best practices to be really accessible and implemented?
Thank you so much, Rose, for offering that from your group. I think that's a really important point, and something that I've learned is how much information people actually don't know about this process and this field and the gaps that exist. And if you are in a space, in a community where you know this information, it's sad, but I'm very aware of how privileged we are to kind of know that now, because there's so many people who have no awareness. What are other comments or things that struck you?
One of the things that I mentioned in our small group was the fact that we have the Affordable Care Act coming up for discussion right after the election. And that is really going to affect healthcare delivery. And as we're well aware, there's already enough of a disparity with healthcare delivery for communities of color. And I do think that I'm a physician myself. I'm not an OBGYN, but I feel as though physicians have been in a position where we have not been able to or willing to advocate as much as we should, because I think a lot of times patients don't know that their health insurance coverage doesn't allow them certain services. You know, they have to come out of pocket if they want certain services. And sometimes that makes a difference if those services will, you know, help a pregnant patient. So unfortunately, there's some problems, lots of problems as it relates to that.
Thank you so much for offering that. I'm going to call you Dr. Ford. I have a question. I hope I'm not putting you on the spot, but I have a question for you. When you are hearing these experiences from patients in these settings, like how does that inform the way you practice? And are there things that you are in conversation about with your colleagues, even if you can't explicitly advocate for the patients like in the setting?
Well, that was one of the things that I found out, although I'm a mother also. So I actually gave birth to 2 boys, and I really didn't have a problem. I was a high risk mom, but because I was a physician, I sort of knew what to expect. And as a primary care provider, one of the things that I've been shocked by is oftentimes when I'm speaking with my patients, they don't know what to expect and they haven't been told. And more often than not, I'm getting the questions and their OBs are not, because they're not comfortable enough asking the OB the question for whatever reason. I'm fortunate because I happen to work in a very collegial environment. I can advocate for my patients. The OB/GYNs that work within our facility are very patient-centered, very proactive. But if there's an issue, I know that this is not the norm for most people. So I think I had a lot to learn, and I learned about it just because, until I started practicing, I didn't really know how much of a problem it was. And until I had a patient tell me, I really, really can't talk to my doctor about this. Can you help me? And can you tell me what's supposed to happen? And I always found myself saying, you know what, you really should feel comfortable with your doctor. You should ask them questions. And this is this is exactly the reason why you should ask. So, you know, there are lots of, you know, I feel like my experience is unusual, so I don't like to make generalizations, but I do like the fact that my patients will come to me and ask a question. They'll make an appointment just to ask me a question, which is great. But you know, for some reason, this type of access for pregnant patients should be the norm. You know what I mean? We shouldn't expect that, you know, patients who are going through, and as you get closer and closer to delivery, you have more and more visits. I find that it's just the opposite with a lot of patients. Sometimes they find out they're pregnant, they go, you know, to a couple of visits, and then they don't want to go anymore. And I keep saying, no, you have to go. You have to go to every one of your prenatal visits. And then as you get closer to delivery, you're going to see your OB once a week. You know, it's just not happening for whatever reason.
I really appreciate that. What are thoughts that others have here in the group? I mean, from all that's been said so far and all that you explored in your smaller groups, what do you think needs to be touched on more? What more research needs to happen? Heather, may I pick on you and ask you to share some thoughts as others kind of think about it?
Sure. Hi, everyone, again. You know, one of the things that I think is important to, I think as a researcher, it's difficult because I'm a very action-oriented person, and it's hard for me to operationalize how do we change things, and then how do we change it not only in research, but how do we change it in practice, and then how do we use those two as evidence and sort of a foundation to then impact policy. And so it's, how do we operationalize that in a collective way also? Because I think it's important to acknowledge that there are a lot of silos that exist, especially in research. If you're a researcher, you know that you'll be in a conference and you'll find someone else who's doing the same work as you. And so it's about how do we collaborate in a way that really moves the needle. It really has that collective impact. And I did want to note that, you know, as someone who doesn't have children yet, I used to say I don't have children, and I put the yet on the end. It's sort of, this conversation is bittersweet for me because in one hand, I think about all the women before me, my family members, my friends, even the women in this group who have experienced, have had some maybe less than pleasant experiences when it came to their birth, and or you know, their baby's health is impacted. And so it's bitter for me because it's like, why are we even having this conversation, right? There shouldn't even be a discrepancy or disparity in how we're treated and then our outcomes. But I also want to say it's a little sweet because the fact that we're having this conversation is sort of that first step in really breaking down barriers, collaborating, and sort of moving that needle. And so I'm in this space where I'm like, wow, this is really great. But in the same time, I'm like, wow, we really shouldn't even be having this conversation. And so I just want to, you know, I appreciate and I receive everything that's been shared in this space, and those who have shared their experiences. As someone who has not experienced that, thank you for being vulnerable. Because I think with every story or every narrative that I hear or I interact with, it goes into my little memory bank. And so when, you know, I'm blessed to reproduce, or when I do choose to have children, just know that your stories and your work and everything that you're doing, you never know who it's impacting. And so until then, I just, you know, I will be an advocate in this space, but I just want to take a second to just appreciate this room and the fact that we are making this agenda that could influence generations to come in terms of maternal health.
Heather, you're a rock star. Thank you for just lifting that up and creating space for that. It's so important. I appreciate you. Before I kind of shift the conversation over for Lisa to kind of address the last question, I just want to hold space for any additional comments or thoughts, anything that's striking you or makes you think a little bit differently about experiences others have had, that you have had, what you want to take away from this space.
I have one more question for you, because I am not a researcher, and I know that a lot of times when we're collecting information, what information is important for me to get to provide you? Because again, I'm not necessarily speaking with pregnant patients at every visit, but some of my patients who are pregnant, there may be questions that I can ask that can help us get to the root of some of those problems. But I want to know, what is it that you want me to ask?
Heather, I was just going to say, Heather, go.
Yeah. This is so crazy how the world works out. This morning, I was in a retreat about patient engagement and being patient-centered. And our speaker was talking about how we have to change our metrics and change the questions that we're asking. And so we're generally very quantitative in how we collect data. And quantitative, just having the quantitative, the numbers, it doesn't tell the whole story. And then you think about, okay, well, let's add the qualitative aspect to it. And sometimes researchers are scared of qualitative, asking the context questions, because in their minds, process-wise, that means, mining through pages and pages and pages of interviews. And so that sometimes that can be daunting for someone who's not prepared. And so I think it's about asking about the quality of people's experiences. To quote Dr. Leonard Berry, who was the speaker this morning, he said, sometimes you just have to ask people, do you feel that you were heard? And if there's a way to collect that, not just on an individual basis, but even from a health system perspective, it doesn't have to be something that if you're familiar with like HCAHPS or like your metric, it doesn't have to be that. It can be something that your hospital, your institution, your whatever organization you're in can collect. Because what that does is it gives, what I like to call is quantitative, gives you sort of the black and white and the outlines, but you got to add the color. And so the color to the picture comes from those stories and that lived experience. And sometimes you just have to ask people. So as a provider, I would say, asking, how was your experience? Did you feel heard? If you didn't feel heard, how would you have liked that conversation to go differently? And when we do that, we're shifting sort of the culture of how we, practice maternal care. We should just shift the culture altogether, because we're changing how we're looking at the patient. Instead of doing to and for them, and this is something I got from PCOR, we're partnering with them and we're treating them as equals as opposed to some sort of hierarchy. Yeah, so thank you. I'll get off my soapbox.
Well, if I can quickly add to your soapbox before switching over to Lisa, I fully agree with Heather. And I also will say another question that is very important that I've seen is, who else would you have in the room if you could add anyone else? My background is bioethics. And so a lot of people, one thing you lifted up, Dr. Ford, is that a lot of people start removing themselves and distancing themselves from the hospital experience when they're not getting what they need, and they start seeking care in other places. So I would rather talk to my mom about, my heavy bleeding than actually talk to my doctor, because I'm not getting what I need there. So who are those voices, if you could add them, that would be in the room? And that informs the way that we can be fluid as clinicians and researchers in the way that we're getting the information that we need, because it has been very sterilized and removed in a way that it doesn't touch the ground. Dr. Wolff.
And I'm going to actually just jump in here too, if that's okay. And I think it's interesting to see all the different perspectives. I'm a social epidemiologist by training. And so what I want to sort of, whether it's qualitative or quantitative, grasp onto is, all of those other upstream issues that affect people's lives, right? The financial security, food insecurity, housing security, unemployment, all of those issues. I mean, there's a number of social needs screening tools out there that hospitals and ACOs use and others. And there's obviously qualitative ways to ask those questions too. But that idea that for so long, we really siloed sort of the physical health of people and the mental health, right? With all of those other sort of, what else is going on in their lives when they're so intertwined, and thinking about sort of maternal health and newborn health. And, no one can be healthy if they don't have a stable house, to live in, or feel like they can feed their family. And so I think that to me, I'll just sort of add my 2 cents there, is sort of another sort of angle as well. So I'm going to sort of take this and sort of put this on all of you who are clinicians or providers or birth workers or practitioners or researchers. As we sort of think about this and move forward, what do you think the research community can do to really advance equity in maternal health? I think that is something that we sort of are thinking about as sort of this research agenda, while also includes other stakeholders as well, but really putting forth sort of a stake in the ground to sort of thinking about those who fund research, like PCOR, and those who are doing research, if there's sort of a push that we can provide. Where do you see sort of it, whether it's certain areas, certain topics, certain approaches? And I see some on the Padlet here about issues related to racism and stress, historical context of inequities, and then obviously sort of that the siloing that we have of patient clinicians and policymakers and others. But can you, anyone want to expand upon any of those, or any other thoughts around, where do you want to see the research community really go and like put it out there to really advance the equity agenda?
I would love, because again, I think a lot of times we have these conversations and we don't necessarily always weight the patient's concerns as heavily as we should. I would love for us to bring this forward by doing some of the same things that the insurance companies, so to speak, have done. They will identify centers that they think are promoting what it is that they cover. And we should be doing the same thing to them, so to speak. We should be saying, okay, we represent pregnant women, and we need you as an insurance provider to make sure that all of these visits are covered, that prenatal, postnatal care visits are covered, that our patients feel like when they are pregnant, that you will provide at least the appropriate medical attention. And I would love for us to sort of identify physicians or offices and insurance companies that are promoting these types of efforts to make advances, so that we don't see these horrible inequities translating into horrible experiences, bad outcomes. Because the only way, quite frankly, that the insurance companies change things is if you can relate it to their bottom line in some way, or if you can relate it to their patient panel. They will take patients away from physicians in a heartbeat, because they can't. But we have to figure out a way to say, we're going to make sure that the patients are going to places where they're going to be taken care of. And if you're not going to be patient-centered, then you can't take care of our patients.
Thank you. Thank you for that. Others, responses, other ideas?
Something that I would like to add, and we touched upon this a little bit in the small group, was just what can we do regarding education of clinicians and talking about best practices. We talked a lot about how implicit bias training only goes so far and only helps those who actually want to be helped. But what can we do even going before that in the training, both in undergrad as well as in professional degrees, to really make sure everyone understands and has that foundation of what the social determinants of health are. And I think research could really help elevate and provide what are those best practices that clinicians should be adopting within their in-person, or I guess telehealth now, interactions with patients, that isn't just following a different questionnaire. Because I've come across that we have all these questionnaires. In school, I looked at one that was the importance of interpersonal violence that exists and affects maternal mortality rates. And that has a questionnaire that requires physicians to do. But all these questionnaires, physicians, it becomes something that they need to check off to do rather than them actually using that information to provide care and tailor their care to the needs of their patients. That includes the social determinants that they are facing that is also having effect on their health.
Thank you for that. No, definitely. Others? Any other comments?
I think having funders that have getting funders to be more understanding of community-focused research. Like I was in a meeting with some program officers at NIH and whatnot, and they're talking about how that's becoming a more popular topic, but the different like departments have different funding pools, and traditionally it's not community-based or social, this type of research that is as heavily funded. And that has implications in terms of research reach, depending on dynamics. So I think that's an important component too.
Anyone else? Any other comments before we close out? Brandy, I saw you unmuted yourself.
Hello.
Yeah.
I just wanted to say, I put in the chat, good evening, how are you? I also wanted to mention policy level change. There's several policies that are addressing maternal and child health. And I think this is a way to, make more changes community level wise. So there are policies that are going on, and that will continue to go on. So I hope that this could be of interest to some of the folks on the call to be advocates for that.
Great. Thank you. So I just want to be cognizant of time and schedule. So I'll take 30 seconds to wrap up and then pitch it over to Heather. Thank you all, first of all, for your engagement and your input, your time, putting yourself out there, your ideas. We've been taking notes in the small groups. We are copying the chat. Megan's been taking notes during this large group. So we are gathering feedback left and right. We will be communicating back out to people. We're going to be taking this output and the synthesis from the patient listening sessions. And as I said, all the findings that also didn't make it into the PowerPoint because there were a lot of them, and starting to develop the actual draft agenda document, and then look forward to further engagement with stakeholders such as those at the symposium, and really again with patients and patient champions themselves through a work group, as well as another round of listening sessions in early 2021. And really looking forward to putting something out there that really resonates with a number of perspectives and captures that voice and really can advance equity in maternal health. So thank you all for your time today. I'll pitch it to Heather to close out.
Thank you so much. This was such a robust, awesome conversation. I feel energized. I did want to take a second to acknowledge one of our guests. It kind of relates to the idea of finding funders who are willing to fund research that is driven by, you know, the patients and lived experience. So Courtney Clyett from PCOR is on the call. So I just, you know, it's so important to have someone who's going to fund the work that we're trying to do. So thank you for being here. So really quickly, just want to remind you, please tell a friend about the work we're doing. The work does not end today. It does not end in this conversation or in this room. You know, when you're on social media talking about what you've learned today, sharing with a friend, please be sure to use the following hashtags: hashtag birth equity, hashtag PCOR, hashtag NMHPN. This has been a phenomenal series. I want to thank Lisa, Shaunesse, Rose, all of the speakers in this group. I'm just energized and I'm ready to make action, right? I'm ready to be the change. I know it's going to sound corny, but I'm ready to be the change that I wish to see in the world. So I hope you feel energized. I hope you walk away with an idea of how you're going to move the needle as it relates to maternal health. And with that, I'm not going to keep you any longer. My dog is begging me to take him on a walk. So thank you so much for engaging with us, for turning your cameras on and being your authentic selves today. We really appreciate it. Have a great evening, everyone. And I'll turn it. I forgot one thing, y'all. I went off my notes. So we are doing, we do have a mindfulness. We recognize that, you know, sometimes when you're talking about your experiences and sometimes it can be triggering. And so we wanted to make sure we created a space for you to be able to decompress and do some breathing. So head on over there. It's with Neka Hall, and she will walk you through how to decompress. And I'm just so excited for what's to come. Thank you, everyone.
Thank you. Good night.